Ask Me Anything. This is one of my favorite segments on the channel and one of the most popular segments as well. So, as I said in the intro, I got a great question about the role and importance and factors involved in soft tissue-based treatment in the treatment, management, and even the healing process of degenerative disc disease. So, what does degenerative disc disease even mean? It means there's degeneration in the disc and it's a disease. So basically, degeneration is just a general term that things get older before their time. I tend to see degeneration in more of like a structural based type of thing. Usually see it in the bone, the cartilage, the disc, and the tendon. I broke that down about the 4 different types of components in an injury. If you're looking at that on YouTube, you're watching this on YouTube, I'll link it up right here about the 4 components of that and understanding the structural component of that. So a lot of times as soft tissue practitioners, we get kind of scared of degeneration. You know, we're like, well, we don't treat the bone, we don't treat the cartilage, we don't treat the disc, and we don't treat the tendon. That's kind of out of our scope. I'll leave that for more advanced practitioners, you know, chiros, PTs, which aren't advanced practitioners on any planet, but also the surgeons as well. So the thing about us is we don't directly treat those structural problems in the degeneration, but we treat all the surrounding structures in there, which happen to be soft tissue components in there as well. So there's 2 ways that degenerative disc disease happens. One is just trauma, like, hey, someone got in a car accident, maybe they got hit really hard, they fell out of a tree, I don't know. However people hurt themselves. This ends up being like 10 to 15% of the presentations that you see. The other one is just repetitive overuse, wear and tear as things kind of build up. That's 80 to 85%. These are the type of clients that I want to work with. Like if someone got in a really bad accident and they ripped their disc, they ripped their bone, they tore their tendon, their cartilage is a wreck. Traditional soft tissue treatment early on in the process isn't going to really help. They would do well afterwards. Those people might just need surgery, but that's not the kind of people that I'm going after. I'm going after that repetitive overuse where things kind of build up over time. So what happens and why does degeneration happen without any real trauma? I get this all the time with my clients and they'll come in and they'll be like, well, I have degeneration, but I didn't do anything. I didn't really have an injury. And I'm like, you know, really good question. Anytime someone asks me a question, I always say, hey, good question. I'm glad you asked. So basically what ends up happening over time in the soft tissue part. So when I break soft tissue down, I call it the fascia, the ligament, the muscles themselves. And then also I consider that nerve entrapments where nerves make their way through soft tissue and fascia and they can get caught up and jammed throughout that process. So what happens over time is these muscles, fascia, are constantly stretched and contract. When they're stretched and contracted, they don't get enough blood flow, they don't get enough oxygen. So what happens is the body actually sends a signal to the brain that there's an injury there because there's a lack of oxygen. Body turns around, starts to lay down scar tissue or adhesion, whatever you call it. And what happens over time is that adhesion and scar tissue gets bigger and bigger, goes inside the muscle. The body's trying in the short term to buffer something because that client is doing too much, beating that tissue up too much. That scar tissue gets in there, makes that muscle weaker, less flexible. Now what happens is the muscle can't generate the force that it needs to. So it puts more and wear and tear on the joint, on the cartilage, on the tendon, all through there and even the bone. So what happens is over time it puts pressure down on those areas, and then you get the degeneration in there as well. So soft tissue actually is the key in the healing process. It's kind of what started it. You know, so many times people look at degenerative disc disease and they're like, well, I have this problem, I need to fix that. And that's the effect, but the cause is actually the scar tissue in there as well. So getting in there and treating the tissue is so important in the early part of the injury, definitely in the post part of the injury, but a lot of people don't understand the role of soft tissue and they get scared of going in there and actually working on someone that has degenerative disc disease. Oh, it's scary from what you see. So how to manage it / treat it. Number one is you have to change people's identities. Don't let clients come in and be victims. You know, they'll come in and be like, oh, woe is me. I had an MRI done and I have degenerative disc disease and there's nothing that can be done for me and I'm probably going to need surgery. It's like, slow the fuck down. Let's process this a little bit. And that's what happens is these surgeons scare the hell out of people. They're like, well, you have degeneration and we need to do surgery. It's like, well, maybe down the road, but let's start earlier and do some things that actually get this better? Are we going to get the tissue clean? Are you going to stop eating like shit? Are you going to move? Are you going to take better care of your body? What happens is we have to understand in the medical system is the surgeons get paid to do surgery. So they're always going to recommend surgery. And the only way they get you to recommend surgery is they can scare the fuck out of you. So they're like, you have degenerative disc disease. They threw the disease on the end of that. So it caused that. So you have to change that person's mindset. Like, hey, yeah, you got this problem, but it shouldn't make or break your entire life. They're like, well, I'm never going to do anything again because I have degenerative disc disease. I have degenerative disc disease. I'm 37 years old. Yeah, it sucks sometimes. You know when it sucks is when I don't get good treatment, I eat like shit, I don't move, and I don't get exercise in. You can help your degenerative disc disease. You have to change the way people are. People want to be a victim. They want to be stuck in this mentality of like, there's nothing I can do. No, your diagnosis doesn't define you. Your diagnosis is important. You know, a lot of people are like, well, it doesn't matter what you have, just work through it. No, that's bullshit too. Your diagnosis does matter because it helps you not do stupid shit down the road. Number two is I like to educate. Education is such a key component in the injury process, and not a lot of people do this. So the best education piece that I give for people that have degeneration and scar tissue, I say, hey, think of your degeneration in your disc as your thumb, and they're stuck inside a car door. The car door is all that scar tissue. We can't give this a chance to heal up until we remove that scar tissue. When I say that, people are like, huh, that makes sense. Why didn't anyone explain that? Because here's what happens when people have surgery. They remove the thumb from the car door, and it might feel better for a little bit, but then that car door slams right back down. And I'm making lots of gestures and moving, but it slams back down on there, causes bigger problems down the road. So our job is to get in there and remove that car door by fixing the soft tissue. Now, the third thing is be really fucking good at treatment. Like, don't just get in there with some cups and scraping and all this shit. Get real good with these things called your hands. Last time I checked, you were a manual practitioner. You want to be good with your hands, because if you're not good with your hands, it doesn't matter. Get really, really fucking good, because you can help so many people. Stay the fuck away from surgeries and things that only make things worse. Another thing is understanding the idea of managing the client's load. So in the injury process, you have this one, on one side, it's called your load, what you do, and capacity is what you can take. It's like a teeter-totter, and they got to balance back and forth. What ends up happening is when people do too much load, their capacity can't handle it. So what we're doing as soft tissue practitioners is we're improving their capacity so they can do more load. But usually what happens is people start feeling better and they do more, and it never actually gets better. So our job is getting them to understand what they have, what they can't do, understanding that, like, hey, yeah, you're going to have to take it easy. You're going to have to lay off for a little bit to get this to heal up. I always say it's kind of like treating you for diabetes, and you do really good in the office, but then you go eat a bunch of sugar on the way out. I am the king of analogies and really keeping it simple for people across the board, because we have to manage the load, because people come in and they don't understand, like, hey, you're just doing too much. This is why you're not better. So don't get wishy-washy with it. Don't be like, hey, you need to cut back. Be like, well, they're like, I want to run 10 miles this week. Be like, well, you can only walk 2. That's what you need to do. Be definitive in what you do. Don't be wishy-washy and be like, oh, they're going to get mad if they can't work out. They're going to get real mad when they blow this shit up and they got to have surgery. So your job is to be persuasive, help them in the beginning, but understand that they're doing too much and they need to cut back. And lastly is just setting proper expectations. You know, the way my system works is we take people through these tests and these scores, and we give them a percent function based off like what we see, what their structural problems are, what their tissue problems are, metabolic, all sorts of things. And I say, hey, you know, right now you're functioning about 40%. I think a reasonable goal to get you to 85, 90%. We're not going to get all the way there because of that degeneration. And when you're honest with people about that, they understand that they're not going to be perfect, but they're going to improve, because 80% is a hell of a lot better than 40%. So just being realistic. Don't be like, oh, I can fix all your problem with just this one thing and you're going to be great to go. No, just be honest with them. But it's like, you're going to get better based off the amount of dumb shit that you stop doing as you go. So just to recap, change their identity. Don't let them be a victim. Educate them about what's going on and how the soft tissue can help. Get really fucking good at what you do. Manage their load in what they do. And lastly, set the proper expectations. So I went on a little bit of a rant there, but really good. I appreciate this question. It was awesome. If you liked the video, share it with somebody that might think that they're stuck being in degenerative disc disease for the rest of their life, and that's their identity. Change that. If you have any questions you want me to cover on Ask Me Anything, send them in. Always happy to answer these questions. I love doing this segment. Go grab my free training. It's all linked up here. I think my free training is better than any paid course you can go out there and take across the board. I put so much in there because at the end of the day, I just want to get this care to more people and not have people be fucked up on pain pills, and injections, and surgeries, which only make things worse. And lastly, go out there and be great. Really great. Push yourself. Don't be mediocre. Don't get stuck in comfort. Be so great, so awesome that they can't ignore you, because at the end of the day, the only thing that truly pays is being amazing. I appreciate you guys, and I will see you on the next one. Bye.